Hello, and thank you for watching this educational video about the High Deductible Health Plan 2500, also known as the Hdhp 2500 plan. The Hdhp 2500 plan accesses a PPO network. Your PPO network is listed on the front of your medical ID card. Be sure to check the network status of your medical providers prior to seeking medical care. You may check network status in the following ways. Contact your medical provider and ask them whether they participate in the PPO network that you access. Visit AdvantageHealthPlans.com and choose Find a Doctor or Pharmacy from the quick links on the homepage. Scroll down to the list of provider networks and choose the corresponding network. Or, call Advantage Health Plans and speak to a Kempton Care advocate. Remember, accessing a network provider doesn't always guarantee the best price. It is important to note that there are certain providers that are excluded from Advantage Health Plans, regardless of their network participation. A list of these providers can be found at AdvantageHealthPlans.com. Advantage Health Plans provides alternative options to help save you money and make better healthcare buying choices. In order to make the decision simple, these alternative options have an enhanced benefit. These are enhanced benefits since services obtained from a network provider would generally be covered at 80% after your deductible has been met. Many medical services are available through KPP-free, such as orthopedic procedures, diagnostic imaging, general surgeries, urology, ear, nose, and throat, gynecology, oncology, inpatient cardiac testing, bariatric, digestive testing, sleep studies, and more. If you choose to use KPP-free, your medical services will be covered at 100% after your deductible has been met. Additionally, since the pricing offered by providers who participate in KPP-free is better than pricing available through the network, your cost, up to your deductible, will also be lower. Using KPP-free is as easy as 1, 2, free. Just call Advantage Health Plans to get started. After your deductible has been met, your laboratory services can be covered at 100% if you choose to use a laboratory provider that is directly contracted with Advantage Health Plans for enhanced benefits, such as LabCard, Diagnostic Labs of Oklahoma, Quest Diagnostics, Clinical Pathology Laboratories, and more. Visit AdvantageHealthPlans.com for a full list of participating laboratory providers and draw sites. You may also receive some medications at an enhanced benefit, waiving your coinsurance, after you meet your deductible. We will discuss this further in a moment. Important reminder, under IRS guidelines, with the exception of ACA-mandated preventative services, participants enrolled in a qualified high-deductible health plan must meet the deductible before receiving a 100% benefit. The individual deductible for the Hdhp 2500 plan is $2,500. The family deductible is $5,000. If you have selected employee-only coverage, you must satisfy the employee-only deductible of $2,500 before the plan pays for any benefits other than preventative services. If you've selected family coverage, the family unit deductible of $5,000 must be satisfied before the plan pays for any benefits other than preventative services. However, if a member of the family unit meets at least $2,800 of the family deductible amount, the plan will pay benefits on that member subject to the plan out-of-pocket requirements. The individual out-of-pocket maximum, including all deductibles and copays, is $5,000. If you have selected family coverage, the family unit out-of-pocket maximum is $10,000. However, if a member of the family unit meets the individual out-of-pocket of $5,000, the plan will pay 100% for that individual only. The coinsurance percentage for this plan is 80%. After your deductible, Advantage Health Plans will pay 80% of covered charges, while you'll be responsible for the remaining 20%, up to your out-of-pocket maximum. Physician office visits, specialist office visits, and urgent care charges will be applied to your deductible and coinsurance. Your deductible and coinsurance will be applied for all medical services performed in an emergency room. For procedures performed outside of your physician's office, you will pay your deductible and then 20% coinsurance up to your out-of-pocket maximum. Remember, an enhanced benefit may be available through KPP-free. Pre-certification of all inpatient confinements, outpatient surgeries, and sleep studies is required. Pre-certification is ultimately your responsibility, even if the medical provider often performs this task. If you are unsure if your medical service requires pre-certification, or to find out if your provider has performed this task, please call and speak to a Kempton Care advocate. For outpatient laboratory services, Advantage Health Plans will pay 80% of covered charges after your deductible is met. You will be responsible for the remaining 20%, up to your out-of-pocket maximum. Remember, an enhanced benefit may be available if you choose to use one of the laboratory providers who are directly contracted with Advantage Health Plans for enhanced benefits. After you meet your deductible, Advantage Health Plans will pay 80% of covered charges for diagnostic imaging services. You are responsible for the remaining 20%, up to your out-of-pocket maximum. Remember, an enhanced benefit may be available through KPP Free. All charges for inpatient hospitalization are subject to your deductible and coinsurance. Your prescription benefit plan through Advantage Health Plans is administered by Southern Scripts. It is important to remember that the use of a participating in-network pharmacy is mandatory. Prescriptions filled out at an out-of-network pharmacy will not be covered. Check AdvantageHealthPlans.com for a list of excluded pharmacies. For prescription medications, after your deductible has been met, the copay for generic medications is 10%, and the copay for brand name medications is 20%. You may receive a 102-day supply of covered medications that are included in the maintenance drug list at the same copay percentages. It is important to note that if you select a brand name drug when a generic drug is available, you will pay your deductible and applicable copay percentage plus the difference in cost between the generic and the brand name drug. There are specific high-cost brand name prescriptions that have a lower-cost therapeutic alternative. If you choose one of the medications on the therapeutic alternative drug list, your copay will be 50% of the cost of the drug after your deductible has been met. A drug will not be included on this list unless it has a lower-cost therapeutic alternative. This list is available at AdvantageHealthPlans.com. You may obtain some medications, including some over-the-counter medications, at an enhanced benefit. The list of covered premier drug tier medications is available at AdvantageHealthPlans.com. Specialty medications are exceptionally high-dollar prescriptions used to treat complex chronic conditions like cancer, rheumatoid arthritis, and multiple sclerosis. These medications often require additional medical management and oversight. For specialty medications, you will pay your deductible and then an additional copay of 10% for generic medications or 20% for brand name medications. Specialty medications must be obtained through the Southern Scripts Specialty Pharmacy. For assistance with your out-of-pocket costs for some medications, please contact Advantage Health Plans and speak to a Kempton Care advocate. Be on the lookout for communications from Script to Savings. These communications may come via email, text message, or snail mail. If you receive a communication from Script to Savings, it will include information about how you can save on your prescription medication costs. This plan does not have a benefit differential when utilizing an out-of-network provider for medical services. You are free to use the provider of your choice. However, all out-of-network claims must be processed at the maximum allowable charge, which is often a percentage above the provider's current Medicare rate. If no Medicare rate is available for a particular service or provider, another reference will be used. Physician's charges are processed at the provider's Medicare rate plus an additional 30%. Facility/hospital charges are processed at the provider's Medicare rate plus an additional 60%. Anesthesia charges are processed at the provider's Medicare rate plus an additional 150%. Outpatient laboratory charges are processed at 100% of the provider's Medicare rate. Emergency charges are processed at the provider's Medicare rate plus an additional 100%. Air ambulance charges are processed at the provider's Medicare rate plus an additional 20%. Advantage Health Plans has a partner that offers a robust patient advocacy program. If you need assistance speaking with an out-of-network physician or facility about whether they will accept the plan's reimbursement, pre-service advocacy is available. A team can assist you in finding a provider that has agreed to accept the plan's allowable reimbursement. If a balanced billing situation does occur, there is a comprehensive patient advocacy process in place to assist you. Call and speak with a Kempton Care advocate to learn more or to get assistance with a balanced bill. Additional information about your benefits, including a summary of benefits and coverage and your summary plan description, are available by visiting AdvantageHealthPlans.com and logging into the member portal. If you have questions about your benefits, please call 800-324-9396 to speak with a Kempton Care advocate. They are available Monday through Friday, 8 a.m. to 5 p.m. Central Standard Time. Thank you for listening to this explanation of the benefits available under the Hdhp 2500 plan, and thank you for being a participant in Advantage Health Plans.